From the WRAL News and Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, February 1st. I'm Julian Grace. Before we get into the latest stories, we want to ask you a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to fill out, and we would really appreciate it if you would fill that out for us. You can find it at WRAL.com/coronapod. Again, that's WRAL.com/coronapod. Thanks so much. Now for the latest coronavirus headlines. This week, the federal government will start shipping more vaccine to all 50 states. An additional 1.4 million doses will bring the total number of shots to 10 million every week. That's a 16% increase. Here in North Carolina, that means an extra 20,000 doses are headed our way. Health officials say the supply will only scratch the surface with the current demand. Here's WRAL's Travis Fain with North Carolina Health and Human Services Secretary Dr. Mandy Cohen about the challenges ahead.
You've talked about the kind of the guesstimate on when we have enough vaccine for everybody who wants it to get it being spring. Can we drill down a little on that, though? Is there a month? And then that's just the first dose, right? Then another 3 to 4 weeks for the second dose, and then a little while for that second dose to have maximum effect. So we're really talking further into the summer before that really starts to catch up with the virus, right?
I think late spring is optimistic. I think we are talking about the summer. And again, this all depends on a number of factors. How much vaccine are we getting from the federal government? And I think that matters on manufacturing, like how much manufacturing are they doing of the 2 vaccines we have now? But are we going to have another available vaccine? There are additional vaccines in the development process. Are they going to be approved? What does that timeline look like? How much dose will be available? Those are all of those factors we don't know yet that really help answer that question for you, Travis. So I want to say optimistically the summer, but I'm hopeful that we could move that up sooner. But I can't say that with any certainty yet.
And once it really scales up, do we have enough manpower? Do we have enough freezers or whatever else we need? What are the problems that you see 3 months from now that we need to prepare for now?
Right. Well, in the immediate moment is certainly still supply. We have given 99% of our first doses that we've been allocated by the federal government. Now, that changes week over week. So right at this moment, we're waiting on a new shipment from the federal government because we've used 99% of our first doses. However, as we go forward, and I hope to see more vaccine supply, I think we do have to make sure we are planning for that capacity. That means we're going to need more providers doing the vaccinations themselves. Right now, we're not there because we barely have enough vaccine to go around to the providers we have enrolled and working right now. So we want to be really strategic about bringing on our new vaccine providers. But as we get more vaccine supply, we certainly want to make sure we can ramp up that capacity really quickly. And so that's what we are working through with our partners right now. What can you do today? What can you do in 2 months, in 4 months? Because this vaccination effort is going to be a marathon. We're going to be vaccinating for a long time. So I also need to know what they can sustain, not what could they do in a heroic moment for 1 week, which they absolutely did last week, but what can they sustain over many, many months? And I think that's what we're working through with our vaccine providers right now.
An initiative at North Carolina Central University is working to make access to COVID testing and vaccines more equitable. Faculty and students are involved with the Advanced Center for COVID-19 Related Disparities at NCCU. They studied the perception of the virus in underserved communities. They are hosting testing events and working to educate people about the vaccine by providing accurate data and testimonials from trusted community professionals. And the state wants more inmates to get vaccinated against COVID, and they're offering incentives to do it. Eligible prisoners can reduce their sentence by 5 days. Those who don't qualify receive a $5 canteen credit. Any inmate vaccinated will have 4 extra visiting sessions and 1 free 10-minute phone call. That's all for the North Carolina Coronavirus Podcast News Brief. I'm Julian Grace.